Deputy Pauline Tully.
Thank you, Cahir. Minister, have you or will you raise the shortfall in skilled mental health staff with the Higher Education Authority with a view to expanding the number of places available in the subject area in third-level institutions in this country?
Minister.
I thank Deputy Tully very much for her question and to assure her that my department is committed to supporting the mental health of the population through the provision of graduates with the key competencies and skills that are required to be effective in the health workforce, and to support a range of clinical teams, including the very important issue that the Deputy highlights regarding supporting people with eating disorders. It is a statement of fact for me to say that the number of skilled mental health staff that need to be trained or recruited is a matter for the HSE, for the College of Psychiatrists and for other relevant professional bodies. So they, as part of their workforce planning, need to come to the education system and say, we believe we need X number of new people trained in these positions or professions over the next number of years. I do understand that the College of Psychiatrists recruits approximately 60 new trainees per year, and also to become a specialist doctor in psychiatry takes at least 7 years. The number of trainees is determined by planning for consultant numbers into the future by the Department of Health and the HSE, in collaboration with the HSE's National Doctors Training and Planning Unit and the College of Psychiatrists. My department understands that work has now been done in this area by the National Doctors Training and Planning Unit and the HSE, who have noted the potential for an increase in the number completing this training in the years to come. Planning for and decision making in relation to expansion of those training places is a matter for the Department of Health, the HSE and the College of Psychiatrists. My department, the HEA and the higher education institutions stand ready to help. We're committed to support the provision of graduates for the health service through undergraduate and postgraduate provision, and we are actively engaging, in fact we're engaging as we speak with the Department of Health in relation to their health workforce planning needs. If they tell us what they believe they need into the future and what role we can play in helping that, we stand ready to help them. And I think the Deputy's highlighted a very important and sensitive area where we clearly do need to be training more people, and we're working hand in glove with the Department of Health and the HSE to try and assist in that regard.
Mr. Deputy.
Thank you, Minister, for your response. Look, I was concerned with the information I received in a reply to a PQ submitted recently in relation to services for persons with eating disorders. Now, the reply I received indicated the HSE developed an approved model of care for eating disorders, but it was launched in 2018. But to date, out of this eating disorder network of the proposed 8 adult teams and 8 CAMHS teams, only 3 teams have commenced recruitment and are delivering a service. Now, 2 of them are CAMHS and 1 is for adults. So that's only 3 out of 16 in 3 years. Now, the HSE is provided with funding on a yearly basis, and I'm told funding is available this year also to progress the recruitment of clinicians. But I want to quote that they've said the availability of skilled staff is a significant issue in mental health services where demand outstrips supply in both national and international contexts. So, I mean, there's only 3 adult beds available, I'm told, and they're all based in CHO 6. So there's very limited services available for anyone else affected outside that CHO area. Now, it is recognised that most people can and do get better from eating disorders, and the most effective treatment is in the community. And I mean, the HSE approved model of care for eating disorders it sounds wonderful on paper, but it is around establishing specialist regional teams with the skilled clinicians that will collaborate with hospitals and with GPs. But like with every other medical condition, early intervention is key.
Look, I fully agree with Deputy Tully, and I think, I suppose, we're seeing a theme, and I say this in a constructive sense in the parliamentary questions today, which is in relation to the delivery of public services, a number of government strategies and the likes that want to commit to making improvements in very important areas, but will require us producing more people to work in those areas and to be trained in those areas. I suppose I have to say 2 things, honestly. The first is, obviously, there is a lead-in time in relation to training. So, for example, someone working in psychiatry, we're talking about a study period of 7 years. The second thing I want to say, though, from my department's point of view, is we are ready, willing and standing by ready to help any government department or state agency who wants to train more or says to us we need more graduates in area X, area Y. We are engaging very closely with the Department of Health's Workforce Planning Unit, and I'll certainly feed back Deputy Tully's comments and the statistics she's put on the record of this House into that process, and be very happy to keep in touch with you, Deputy, on the matter. Thank you very much.
Tully.
Okay, thank you, Minister. I suppose it's just to point out, I suppose there is a significant budget there. I think 5.7 million was made available, but only 1.77 has been invested since then. So it's something that I suppose should have been, or should be clearly earmarked at this stage. Money is not being used. Like the money is there, but all the money in the world is useless if we don't have the availability of trained personnel. So I just think it's something that should be actioned immediately to try and get the number of trained clinicians needed. I mean, unfortunately, some people die from eating disorders every year. I think there's something like 200,000 people affected in Ireland at any time, more females than males also, something like 400 new cases a year, which is quite substantial. But if they're given the care they need or the support they need early and the interventions they need early, it will avoid those becoming chronic cases. And I think 6% of chronic cases die, which, okay, the numbers might be low, but still they are deaths, I believe, that could be very easily avoided. Thank you.
Thank you very much, Deputy, and for putting the spotlight on this very important issue. From my own perspective as Minister for Further and Higher Education, in the last probably 3 or 4 weeks, I had a very good meeting with Bodywise and the Eating Disorders Organisation, and we had a really important conversation about how we prepare our services in our colleges for students returning to campus, and we'll get on to questions about that shortly. But we need to make sure that we know we've seen a very significant increase in mental health challenge, anxiety, stress, and no doubt eating disorders as a result of the pandemic. And we need to make sure we have additional supports and also signposting for supports in place for our students as they begin the new academic year. And I'm working with Bodywise to identify how best to do that. So I just wanted to mention that, considering the issue you've highlighted today.
Minister.